Laura, you probably heard of a state that order vaccine mandates. Well, how about in Texas banning those mandates? Texas Governor Greg Abbott issuing that order effective today. A reaction now from Dr. Kevin Campbell, K-Rock Consulting, the president's CEO, cardiologist by training. I didn't think of that he would necessarily, the doctor would be hearing me talking about eating fried chicken and all with my prior guests, so hopefully he didn't hear that. But doctor, always good to have you. You're a big believer in just getting people vaccinated. You try to keep the politics out of it. I always appreciate that. But this move in Texas is going in a different way to say, stop it with the vaccine mandates, period. What do you think?
You know, I think this is a problem because, Neil, there's never been a one-size-fits-all approach to treating COVID or to handling the pandemic. I think that these mandates need to be left to the local municipalities, the county, city level. I don't think that we should have statewide mandates, and I certainly don't think we should have federal mandates. I think that these are big problems that are more political than they are all about the public health crisis that we're in the middle of.
All right, so I know where you're coming from. There are a lot of people who, for various reasons, are sort of anti-vaccine or certainly anti-government telling them to get a vaccine. But we are noticing, whether it's this or other factors, resulting right now in cases falling sharply in this country, down 22% in the latest week. I guess what I'm asking you, is it the mandate thing, or do you really care as long as those numbers go down?
I really think that this is all about the fact that we are doing a better job of getting folks vaccinated. The more folks we have vaccinated, which I know is not a popular thing to say among some viewers, we're going to do better. We're going to defeat COVID. We're not going to defeat COVID without widespread vaccination. There are some cases where mandates have made a difference, particularly in New York, where you're mandating, a lot of the workers there get vaccinated. It's making a difference. And again, a one-size-fits-all approach does not work.
Do you recommend your patients and those you advise, period, doctor, get this booster shot?
I have been very, clear with my patients. I think it's very important for those over 65 and those with a chronic medical condition to get a booster shot. The data is very clear. It definitely boosts the immunity. We're waiting for other manufacturers to be approved through the FDA, and I expect that they will be approved as well in short order.
Real quickly, kids getting a vaccine. Pfizer's waiting for one as young as 5. What do you think of that?
I think it's really important that we vaccinate the youngest and most vulnerable in our population. Obviously, we want the data to be there. We want to make sure that it's safe and it's effective and it's not going to harm the children. The data that we've seen so far before the FDA looks really, really good. So I would say get those kids vaccinated.
All right, doctor, thank you. I was only kidding about the fried chicken thing, as if I would ever eat that stuff.
No.
Of course not. Thank you, doctor. Always good having you, and you have a reasoned approach to all of this.